use a whole different electrical stimulation for acute edema, right? Because we're looking for that high volt. We're looking for a negative charge to help with albumin movement in the cells, to help with fluid movement in the cells, to reduce the edema. So that's our reasoning for choosing high volt pulse current. And through the skill sheet, you'll see that we bundle it with a cold pack. So you'll have to also ask about your cold cryotherapy contraindications. Based on what your patient's condition is, determines if you would use a cold pack that works nicely for an ankle sprain versus a slush bucket which can contour, the ice water contours around the foot. So if you had a crush injury or something like that, then you can use the slush bucket. If you were using this treatment in a sports medicine type clinic, you might do a few treatments with this, right? Because it's better to do 3 or 4 treatments with this within a day than to just do it once. But at least if you have it available, you can at least do it once with this patient. Okay, so I would go through Will. Will has sprained his ankle. We'll start with that one first. Well, then you'll be a question to read, don't worry. I'll step by. Okay, so I would certainly, let me tell you why I'm doing these things and then I'll do them. Because I'm using high volt pulse current, I will be using a small electrode in the area where the injury is so that we have that charge accumulation, that negative charge. I want polarity there. And then I'll be using a dispersive pad further up on his, on the ipsilateral side. I'll put it on his thigh. I could also put it on his low back if I'm treating the foot. And that is a large electrode. It's a dispersive pad, so there's no polarity buildup underneath this electrode. Okay, so it'll only be built up under the other electrode. Sometimes they do feel a little something occurring in this electrode, but very rarely do they ever feel anything. So when you are using these dispersive, there is the conductive side, okay, is this black side, and then you'll use a wet sponge, and then for hygiene reasons, we'll put a wet paper towel on top. So I wanted to start with it dry so you guys can see, because I know this gets confusing when you see it wet already. So if you could wet this for me and then like just bring it out in the sink. And if you can also grab me a paper towel about that size or so, also wet paper towel. Thank you. So I'll be using that. So what that means is since I'm going to be putting that up on his thigh, I will need to do a sensation test not only on the injured area, but also where I'm putting the dispersive pad, and do a skin inspection to make sure that I can find a place on his leg that has, you know, good skin integrity. So based on your evaluation, diagnosis, I have treatment in mind for you, but I first have to ask a few questions. The Raynaud's, the Berger's, cold sensitivity, all of those, okay? The electrical stim contraindications. Do you have a pacemaker?
No, but I am pregnant.
Oh, gosh. Okay, check his, great, thank you much. Oh, wow, okay.
I think it's dry.
You said wet, right?
Yeah.
I was trying to keep it warm for you.
Oh. We'll let that get cold. Okay.
It's going to get cold then.
So check the skin integrity. It's we'll say it's your right ankle. That's the problem. Okay, so I'm looking at his ankle. No open wounds or rashes or burn scars. Looks pretty good. No infections. Check his thigh. Looks good. Good skin integrity there as well. Do a sensation test very lightly, brushing your skin, asking him if he feels it. He won't be looking, right? Right, guys. Going through this quickly for you, okay? If you want me to go through the whole thing, legitimately, I will. Okay, yeah. Okay. So what I'd like to do, Will, is introduce a small amount of current into your injured area, that ankle where all that swelling is. You'll feel a little bit of tingling sensation, and then with the cold, you'll feel the within 5 minutes a little cycle of cold and burn, then aching and numb. This is going to help reduce that swelling that you have in the ankle so that you can get more movement and then get off those crutches, okay? Get you back to exercising and soccer. Okay, does this sound like a treatment you'd like to try? And we operate on a call bell system, so at any time you're experiencing anything I haven't explained to you, you can bring that if you have questions or pain in any way, okay? Great. So as far as the setup goes, I would go ahead and ask you to go ahead and lie down on your back right here. And I'm going to get his injured area elevated. Go ahead and just help me lift your legs a little bit. Good. And then stretch those legs out for me. Perfect. Go ahead and put that one up there. Okay, so I've got his injured area supported, pillows all around. Get you nice and comfortable. support this other leg, shall we? Here we go. All right, and you're gonna have a cold pack. Are you doing okay, or would you like a drape?
A drink?
Yes, with a little umbrella.
Oh, you never asked.
So I want to clean off where I'm going to be placing the electrode. I'm going to be placing the electrode right where his swelling is, on the lateral side of his ankle. That's where the swelling is. So I'm going to just, no motor point necessary, just cleaning that area with that alcohol, and then where I'm going to be putting that dispersive pad on his leg. Okay? And take his electrode. If you had a splitter on your lead, you could use 2 electrodes and 2 active electrodes and place them on either side of the foot. But I want to make sure that when I don't cover up too much of the foot, because I want the cold to be effective. I don't want to insulate them with too many electrodes. I don't have a splitter, so I'm just going to use 1 electrode. Again, not on a motor point, just where all that swelling is on the side of his foot. And then that dispersive is going to be on his leg up here. You want that dispersive to have full contact. So use whatever it takes. If you want to wrap it with an ace bandage, fine. If you want to use the blue elastics, that's fine. Whatever it takes so that you have good, nice contact with this one, okay? I'm not going to do it quite yet. All right, first thing with this machine, please, 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 say plug in, turn on. This is the one where it really can be quite uncomfortable for the patient if you don't do that ahead of time. So plug it in, turn it on. Get to that charge out of there. It'll zero itself out. So if y'all remember from last week, there was, when we did IFC, there was channel 1, channel 2, and then there's high volts over here. Guess what one we're using? High volts. So any of the leads will be fine. Doesn't matter which one. And you just plug one into the high volt. On the lead themselves, they have little stickers, and it will tell you high volt active and high volt dispersive. Active to that little electrode, and dispersive, low current density to the dispersive pad. They do make these disposable, just like those little sticky ones, little kind of one single patient use, which are nice in the clinic, so you don't have to do all this, but this is what we use. So high volt dispersive. So I'm going to put this on your leg. It's cold and wet.
Great.
So go ahead and raise up just a touch so I can wrap that around. Thank you. You can put it on the back of his thigh. That would have been okay too. So the weight of his leg is on it. That's another way to do it. But I'm just using the glutes to hold it in place. Okay? Great. And at this point, I can also get my cold pack and put that on his ankle. And guess what how I'm gonna wrap that? Spica.
Something we have to go through contraindications for.
Yes, you have to ask the Raynaud's
For compression or just.
No, just your just the cold and the cold and the electrical stick. Okay, so get that in place around his ankle, and I'm not going to bore you with my spica. Okay, once around the foot, anchor it in place, and then loop it around the heel, and then do my figure eights all the way around. Like I said, I'm not going to bore you with it. Okay, but you would wrap it up. Time is of essence. Okay, so he's situated, he's comfortable, he's got his bell, and we're ready to go. So on the machine on the right-hand side, so all your IFC stuff is on the left. On your right-hand side, it says a little button there. It says high volt. That makes it easy. You push high volt. Once you do, this one defaults to negative. Perfect. We want that. We want negative charge for him. And if I want to look at what the parameters are for his negative charge, I go over to that toggle switch here. So right now it says 10 minutes and 0 intensity. When I hit the menu button, it will say 80 to 120. That's the range of the pulses per second, high volt pulses per second, 80 to 120. I think on the skill sheet it says 75 to 120 is a good range. So you can just leave it at 80 to 120. It's fine. It falls within the range that's acceptable. And then it defaulted back to the intensity screen, okay, after 5 seconds. So it's everything as I wanted. That was easy. And now I just hit the intensity up. Now, let me tell you, when I start to hit the intensity up, he's not gonna feel anything until like 20 or 30. So that is normal, okay? And then they start to feel a little tingling. I don't want any muscle twitching, contraction, or anything like that. In fact, I want about 10% below a twitch. So if I do see some twitching occurring in his toe, or if he tells me he feels it pulsing in his foot, then I would just turn it down about 10%. Okay, if I get it to 50, I turn it down about 5 notches. Okay, are you ready for me to go ahead and turn it on?
Ready.
Great. So I'm going to hit it fast because I know it's going to take a while. I'm at 10, 11, 12, 13. I don't usually count to my patient. I'm doing that for you guys. 20-ish. Tell me when you first feel a little tingle. Don't want to take too long when you're getting this set up because I don't want him to go numb before the electrical stim starts. Are you doing well?
Little
Feeling it?
tingle.
Little tingle. Can I go ahead and turn that stronger?
Sure.
Comfortable for you? And if you do get any kind of twitching in your muscles or your foot, you let me know.
Okay.
So I'm trying to watch his face, watch his foot. And about 52-ish. Getting stronger but still comfortable. Great.
Starting to contract.
Starting to contract. I'm I've got 65, so I'll go down about 6. There we go. And you're good. Hit the start button. This time says 10. I probably should put that up to about 15. And start. Okay, treatment's running. You're going to call me back if you have any concerns at all. Okay, and I'll see you in 15 minutes. What am I treating? Acute edema. Okay. If it was subacute, I'd use a different machine and twitch. If it was chronic, I would use the other machine also and do contraction.